Bendiciones, su amigo y hermano Puchi Colón por aquí.
¿Qué tal, amigos? Yo soy Giovanni Olaya, vocalista de Pescado Vivo.
Hola, ¿qué tal? Los saluda Pablo Olivares.
Bendiciones, te saluda Omi Alca.
Hola, amigos, les saluda Steven Richards de parte de la banda Un Corazón.
Hola, ¿qué tal, amigos? Muchas bendiciones, les saluda Travis Joe.
Todos ellos, sus mejores canciones y muchos más hacen parte de la programación de Aliento Radio. Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Bienvenidos al show de Avatar Home Health and Hospice. Una vez más vamos a hablar de los servicios que Avatar Home Health and Hospice le ofrece.
Let's switch to English.
Bienvenidos una vez más. Perdón, me equivoqué. Pero today, I'm sorry, I'm getting Spanish and the English confused here. So today we're going to talk about the services that Avatar Home Health and Hospice offers to the patients. And with us is Maya Arguez. She's our marketing director of social media. And she's going to be interviewing me, and hopefully we're going to provide you with a lot of information that is very important to you and your family. If not for today, maybe for next month, or maybe eventually you're going to need our services. I guarantee you that. So Maya?
Yeah, so today I get the fun part. I get to ask the questions. So you're kind of going to walk us through the three major services that we provide at Avatar Home Health and Hospice, which is home health, hospice, and caregiver services.
Correct.
So let's start at the beginning. When people hear home health, what does that mean? What does that service include?
Yeah, that's a good question, and people nowadays are getting confused with home health and home care. When we started the agency 20 years ago, it was only home health. You didn't hear about home care. Now, as the years have passed, you have a lot of agencies that do only caretaker services, which we do also. So then kind of we have settled with home health and home care. So home health is when you have clinicians involved. In other words, you have nurses, therapists, maybe a social worker, home health aides that happen to be certified nurses assistants, and that's what home health involves. In home care, which is our what you call provider services or caretaker services, there's no clinicians involved. There's no skilled services. And the difference between skilled service and no skilled services, the easiest way to figure that out is if you're providing skilled services, the people providing skilled services are going to be licensed and or certified by the state.
Right.
When there's non-skilled services, then it could be somebody without a license, without a certificate, that have gone through some basic training and know how to help the patients.
Right. So who is a typical person who qualifies for home health care?
Well, home health care, as defined by Medicare, is an intermittent service for people who are homebound, and that's very confusing again, and that they need temporary help to get back to whatever their normal is.
Right.
Okay? So most of our patients are of Medicare age, meaning 65 and older, and or have a private insurance. So when a patient is a Medicare patient, when I say Medicare patient, it means that it's a Medicare beneficiary, but maybe they're what is called, or they are in original Medicare, which is when Medicare, you bill Medicare directly, or we bill Medicare directly, or they have an insurance such as an Advantage plan, and then we bill that insurance company. So regardless which of the two they have, I would say 99% of the time, there's no cost for them. Then there's no out-of-pocket expenses.
Right.
Now, you also could be younger and have like a group plan with your employer. And then it depends on the insurance company. And then it depends what is the deductible, how much of the deductible you have met, how much co-payment there is, if there's any co-payment, and so on. So we have to take it on a one-to-one basis.
Right, so you don't have to be a senior. It's not just for seniors.
No. In home health, we can treat anyone. However, because of our agency and the way that we have developed the agency, 99% of our patients are 65 or older. That is not to say that we couldn't treat somebody in their 40s or 30s or 20s. Now, we do not do pediatrics. We don't do kids, so that would be 18 and younger. We used to a long time ago when we started the agency, because we're in North Houston. You know, the Houston, you say Spring, North Houston area, the Woodlands, and north of that. Even though we also go to the south, but our zip code is in Spring. So when the Children's Hospital had a patient back then, I'm going back 20 years, 18 years, and there were not that many agencies, they would send us a referral. And we felt bad not taking a kid. So in many cases, we didn't get paid. We took kids, we took children for about 2 or 3 years. It wasn't too many, but whenever they send us one, we accepted them. But as more and more agencies became licensed, and some of them started specializing in pediatrics, then we didn't feel guilty, because that's how we felt, because we think that we're here to help people. But so the pressure was taken off of us, and now we don't deal with pediatrics anymore.
Right.
But if you're an adult, yes, we're gonna help you.
So let's say someone meets that criteria, they're gonna start their home health services with Avatar. Mm-hmm. What does that team look like, and who actually comes into their home?
Okay, so a typical patient is gonna get always a nurse. And then physical therapy and occupational therapy, those are pretty common, and a home health aide. So if the patient has had a stroke or they have other issues, they might get a speech therapist. Because when you have a stroke, you really have to be trained how to speak again and how to swallow. Right. In some cases more than others. So for that, you need a speech therapist. But the typical patient is going to get a nurse, a physical occupational therapist, and a home health aide. Once in a while, they might need a social worker, and then we'll provide them with a social worker. And what that social worker is going to do is they're going to see what needs does that patient have outside the services that we can provide them with. So in many cases, our patients are of low income. So they really have very dire circumstances, because they're old, they're sick, and they're poor. So when that happens, you have to see how can you help them, because we can provide them with the nursing, we can provide them with the therapy, the home health aid. But when it comes to food or medical supplies or medical equipment and so on, our hands are kind of tied, because in home health, we will have to go through the system. We have to go through the doctor, we have to go through Medicare or Medicaid, and sometimes it's a little bit difficult to get those services. So what we do is we get our social worker involved, and she has more tools to make sure that the patient gets, like for instance, one very popular service is Meals on Wheels. So that way we know that patient is getting at least 5 meals a week. Or the transportation for the county there's ways for the county to take them to the doctor and then come back and pick them up. So we will do that too. That's called MetroLift. Now that's in Harris County. Now in Montgomery County, there's similar services. And those are the two main counties that we serve, by the way. We serve Harris and Montgomery County, but we're not limited to that. We do a little bit of San Jacinto County, Liberty County, Waller County, Fort Bend County, and maybe a little bit of Brazoria County. It all depends. The best thing to do is, regardless of where you live, as long as you live, say, close to Harris and Montgomery County, the best thing to do is to give me a call at 281-703-8050. And that's my personal cell number, by the way. I don't give you my office number. I don't give out my office number because the people that are listening to this blog, I want them to feel that if they need to talk to me, they can get to me immediately. So with the number I'm giving, 281-703-8050, that number is my cell number. That's where my grandkids call me on, my wife, my daughter, my great-grandkids are not calling me yet because they're too young. But one day they'll be able to use that. I hope that I'll still be around.
Okay, so with that in mind, home health can kind of lead into our next service, which is hospice care. So what is hospice care?
Okay, hospice care is it's a lot different than home health. So not because of the services, or they've got similar services, but because of the goals behind it. In home health, the goal is to take that patient and make him as good as they were before or as close as you can get them. And then we have to discharge the patient. So again, home health is an intermittent service. So you can be our patient, we keep us for 2-3 months, depending on what the insurance says and what your needs are. Then we discharge you. 2-3 months later, you call us and say, hey, I need the services, or my husband needs the services, or your doctor sends us an order, and we start the services again. 2, 3, 4 months later, we discharge, and that will go on basically for the rest of the patient's life. Hospice is different because hospice is designed for the patients that have a terminal illness whose life expectancy is less than 6 months. So when we get a patient for hospice, they're gonna get the nurse, they're gonna get the home health aide. If it's adequate, if the patient really wants it, we do therapy also. In most cases, hospice patients do not get therapy, but not because we cannot provide it, but because they cannot do the exercises. And then on top of that, they're gonna get the chaplain, they're gonna get the social worker, they're gonna get the visiting doctor, which are things, except the social worker, in home health, you don't get chaplains and you don't get visiting doctors. When it gets to medical equipment, in hospice, we don't have to deal with that bureaucracy that we do in home health. So in other words, let's say I'm talking to you, and let's say one of your parents is gonna go into hospice. So I'm gonna go and say, okay, Maya, so do you think your mom could use a hospital bed, bedside commode, bedside table, a Hoyer lift, oxygen? And I will go down the line, and you tell me what you think she needs, and I'm gonna order it. And by the time we start the services, all the medical equipment is at the patient's home. Medical supplies, the same. We supply the diapers, the wipes, the lotion, the gloves, anything that is classified medical supplies. And then we also supply them with the medications. So in hospice, there are certain medications that eventually almost 100% of the patients are gonna need, because depending on the disease that they have and the illness that they have, they might get in pain. If they're not in pain now, the pain will come up, hopefully not. But if they're in pain now, that pain is going to worsen. So we do what pain management, because the philosophy in hospice is no, we know that we're not going to cure the patient. No, we know that we're not going to discharge the patient unless they want us to discharge them. We're going to be with the patient for the duration. So normally the length of service with hospice is 6 months or less. But if the patient goes beyond the 6 months, there's no penalty, there's nothing. Unlike home health, we never bill the patient for anything. So there's no copayments, there's no deductible, there's nothing. If we accept the patient in our home health hospice services, we are responsible to take care of that patient whether we get paid or not. So it's a much more complete, comprehensive service. It's not only for the patient, but for the family. So when we go to the patient's home, and I'm going to take one example. A few years ago, we went to a patient's home, and the nurse said, look, daughter A is taking it beautifully. She understands, and she's okay with it. Daughter B is falling apart. We start talking to the mom, and she starts crying and crying and crying. So now our services are extended to the family. So we don't provide nursing for the family, but we provide the chaplain and the social worker. And the social worker is trained in counseling. So they help the patient the family of the patient to deal with this very, very difficult time of their lives that they're going through. They're losing their husband or their wife or their parents. So it's very difficult. And we're helping it through that. In hospice, by the way, so another difference between home health and hospice is that in home health, we focus on the physical. Yeah. Hospice, we look at the physical, the emotional, the spiritual. So actually, it's a beautiful, beautiful service, something that is very dear with my life. I have had experiences that are very, very touching. They're very unbelievable, and they have made me actually a better person.
So from my understanding, hospice is a lot more about comfort than about curing. But what are some of those signs that it might be time for hospice when you're thinking about your loved one, your husband, your parents, whatever it might be?
Well, number one, it helps if the family, and this is the very difficult part. If the family was to go to the doctor and say, doctor, what do you think? How bad is my mom, or how bad is my dad? Usually they don't do that. They try to get the doctor to help their parents or the parents to live as long as possible. However, there comes a point, for instance, the patient starts losing weight and they cannot explain why. They start losing memory. Sometimes they forget what they're talking about. They forget who you are. So those are signs of dementia and Alzheimer's. So that's could be the beginning of the end. Then, of course, in case of a cancer patient, it's more cut and dry, because once the doctors, the oncologists decide, or the radiologists decide that, look, why keep torturing, because that's what it is, the patient, when we know that it's not going to work. The patient is going to die, whether we continue with the aggressive treatment, whether it's chemo or radiation. So why don't we stop it now and allow the patient to enjoy as much as possible whatever they have left in their lives. So to give you an example, we have patients that after they go into hospice with us, with Avatar Home Health and Hospice, they say, hey, am I allowed to go on a cruise? Yes, you are. am I allowed to, my family wants to have a reunion out of state, and would like to go there because I haven't seen my relatives, some of my relatives, in 15, 20 years. Yes, you can do that. So it's not as, it's different. It's different. Now we know that you're gonna, you're coming towards the end of your life, and we're not gonna be telling you, oh, don't eat salt, or don't eat sugar, or don't eat. It's really up to you. Of course, our nurses will advise you what it would be best for you, because we don't want your blood pressure to, go to a 200 or anything like that. But up to a degree, you're free to do whatever you want to do. And that is a beautiful thing, because in the other hand, you have patients that do not get the opportunity to get hospice care. And then when say at the end, when the doctor calls us or when the family calls us, we go there to do the hospice consult. And sometimes I go to the hospital and I see the patient in bed and I go, what are they calling us for? The patient and the family is not going to get almost any relief. Because the thing about hospice and why I'm so, I would say, in love with hospice, or I like hospice so much, is that we help the family and the patient through a process of accepting that the patient is going to leave us, and then enjoying together as much as they can, the time they got left on earth. And that's very powerful.
Yeah, it's kind of like that shift in mindset where now the goal is comfort and quality of life rather than quantity. So with that in mind, does enrolling earlier in hospice provide more support for the patients and families?
Well, the earlier you do it, the better it is. Because we have more time to work with the family and with the patient. Not only that, there's a myth that, if I put my mom in hospice, she's gonna die real soon. That's not true. If you have everything the same characteristic, the same age, everything the same with two patients. One starts doing hospice, the other one continues with home health or with chemo, whatever they're doing. The average is that the patient in hospice is going to live 15% longer than the patient that's still getting the treatment and so on. So it's much better for the patient once the doctor says, look, there's no hope.
Right.
Just the best thing to do is just to start getting hospice services.
Right. And you've talked a lot about the services that come for the patient, but can you touch a little bit more about how it helps the entire family?
Well, yes. Like, for instance, when the chaplain goes to the patient's home, and let's assume our demographics here in Houston, North Houston, South Houston, wherever you are, the fact of the matter is that we are in the Bible Belt. So it's most of our patients are believers. So the chaplain comes and she's going to pray with the family and with the patient. She's going to read the scriptures. She will sing with the family. If they don't know the song, that's okay. She doesn't care. She will sing along because she's a very beautiful human being. And so we get the family involved that way. So we give it that spiritual support they need. If they want to take communion, the chaplain will bring communion to their home. And then you have the social worker, like I explained before, that she's training in counseling. And it's not only for the patient, it's whoever in the family is going through a hard time. We will offer the services to the patient, to the family member. So it's a very, very special service. I feel sorry. Many times we have a patient that I know that is appropriate for hospice services, and a child or the husband or the wife says, like right now we have at least 5 patients that should be in hospice, but the family's in denial, and they think they're going to kill the patient if they put him in hospice. They're continuing with whatever treatment they're getting, and the patients are getting worse, and they're not getting the level of care that they would have been getting in hospice.
Right.
So, but you cannot force people to do something they don't want to do.
Right.
So we have to respect their wishes, and we tell them, up to a degree, we tell them, look, this is the best thing to do with your husband, wife, parents. If there's a lot of resistance, we back off and say, okay, we're here whenever you need us.
Right. And I think now with the holidays coming up, that's a great time for families to get a lot of quality time together and start to notice some of those signs of maybe it is time to learn a little bit more about hospice,
Yes.
speak with a doctor, call you, and kind of get feelers
Yes.
for what is hospice and how can it help.
Yes, there's always, and that's what we do in these blogs, and we do all the social media that we're doing, and open to recently, we're doing a radio show every Sunday, which, by the way, we have access to all the radio shows. If you log into our web page at avatarhomehealth.com, and there's a button that says, I think it says media, and you click on that, you can get the radio shows, you can get our blogs. And we did radio shows for 5 years, so there's a lot of good information there. But yeah, so we have, as far as, it's always a good time, but this brings a family together. And even though you don't want to be thinking about this now, we need to be vigilant about our loved ones. And if we see that things are changing, talk to your doctor and ask the doctor, look, I want to have an honest discussion about my mom or my dad or whoever it is. And, tell me, don't pull any punches, tell me the truth. And so we can make a smart decision, whatever is best for the patient.
So really quickly, let's touch on caregiver services. What does that include, since it is a little bit different than home health and hospice?
Yeah, so that would be what is called today home care. So it's actually a caretaker, meaning somebody, they don't have to be licensed, they don't have to have a certificate, and they come to the patient's home, and they take care of them with their daily activities,
right,
such as taking a shower. They might go grocery shopping with them. They might go escort them to the doctor, go to the pharmacy and get prescriptions for them. And sometimes just a mere fact that they're there with the patient, and sometimes they sit and watch television. Again, it's up to the family, the patient and the family, because these patients it gets to the point where they've done all they could do that particular day to help them, and then they can just talk to the patient, play cards with the patient, take them out for a walk around the block. So it is also a very important thing to keep the patient from declining and to keep them active and having some kind of social interaction with another human being. And that service is a little bit different when it comes to payment. So that service can be paid for by an insurance company if the person has what is called a long-term policy. If they do not have a long-term policy, then if they have Medicaid. If they don't have Medicaid nor a long-term policy, then it becomes a private pay kind of thing. Yeah. So you can, if you call us at Avatar Home Health and Hospice, says, I want provider services or caretaker services for my mom. So we're going to talk to you about a budget. What is your budget? And as far as I know, today is November of 2025, and we have one of the lowest rates in Harrison, Montgomery County. And basically, you got to pay. We have to do at least 3 hours at a time. They have to be contiguous, and that will cost you $75. That's Monday through Friday during office hours. If it is in the evening, early morning, or the weekends, then it's going to be $90 for 3 hours. So, but then when you need it, you need it. Like sometimes we have patients that are in home health or hospice, and they're getting all the help that we can provide them, and they say, well, but I want to go to church on Sunday. Okay, so you can contract one of our, you call us, say 4 hours on Sunday, so we go there from 10 to 2, 8 to 12. You're able to go to church. You're able, oh, I want to go grocery shopping. I want to go to the movies. Right. Or listen, because as a caretaker, you're working 24/7. So you might just want to say, look, I just want to be out of the house for 4 hours.
Right.
So we go there, we take care of their loved ones for 4 hours. They come back and they feel refreshed, and they're a little less stressed as they are when they're always taking care of the patient.
Yeah. So it is, in that way, a very personalized service where you can choose the hours, choose what they're helping with, that kind of thing. So how does that kind of pair with home health or with hospice care?
Well, the biggest difference is that there's no skill services. So there's no nursing, there's no physical therapy, there's just a caretaker.
Right.
And the caretaker does not have to be certified. So now the family could choose to have a CNA, but that now when you're talking about a CNA, it gets quite expensive. So most people choose to have a qualified, well-trained caretaker. Now, keep in mind that whether it's a nurse or a therapist or a caretaker, we have to check everything on that person. It's like, they're asking for employment with us, so we have to make sure that they're a good character. We check their criminal background. So we make sure that we're going to put in your house somebody that we will allow in our house. And that's the way we work.
So in addition to that, though, if, let's say, your mom is on home health, you can also have a caregiver simultaneously.
And that is the reason why in 2010, we added the hospice component to our agency. So at the beginning with the caretakers and home health, then we added hospice, because that way we have a complete continuity of care that very, very few agencies in Texas can claim that. So you can start with us just taking caretaker services, getting caretaker services. Let's say you fall down, you have a surgery, something happens, you go into home health, and then you can still have the caretaker services. We take care of you, and you get discharged from home health. You still have the caretaker services. Let's say 2, 3, 4 months later, you come back to home health, but now you start declining and you need hospice, and the caretaker services can always be there.
Right.
So it's a complement. The services complement each other. The only thing is that if you have home health, you cannot have hospice. It's one of the two. But as far as the caretaker, and that's one of the things that the families love with us, because once the patient and their family get used to and develop a relationship with a nurse and a home health aide, if they're going to hospice, they're going to bring somebody completely new, and they have to start that relationship again. And that's very hard on the patient. So it's much better if you're with Avatar Home Health and Hospice, and you go up and down that continuum depending on what you need.
Right. Yeah, and I think, as you said, that's something that's really specific to Avatar, where you can have all those services, and you could be with us getting the same caretaker. We try to give you the same nurses for your whole experience when possible.
Right. That's right. Yeah. So it's very, very, again, very unique. There's certain things that we do, and the fact that we have like 3 different agencies under one umbrella is just something that is very, very unique. It's difficult because imagine if you have one agency, a home health agency, with all the regulations and all the problems, hiring and keeping nurses and keeping therapists and so on. Imagine now you have 3 of those.
Yeah.
Because you have to do the same thing for home health and hospice, and then you have to the caretaker services are a little bit easier, but you still have to hire and fire and keep the people happy and be answering the phone. So I know they're paying, all the expenses for liability insurance and malpractice insurance, and you go on and on and on. So for us to be doing 3 services under one license is very very different and very difficult. We're used to do it. We've been doing it for 20 years, and we have the best staff there is, and that we can say that for the nurses too. When we started back in 2005, 2006, we started the agency with 3 employees. It was my daughter, my wife, and myself. Today we have 150 employees. We started with 0 patients. Today we got close to 500 patients. So we have really changed. We've really grown, and not only in size but in experience.
Right.
And so if you talk to any agency out there, there might be 1 or 2 that have been in business longer than us. But if you find an agency like ours, we've been in business for 20 years. We have received the Gold Seal of Approval from the Joint Commission, and we don't have time for me to explain that, but only 9% of the agencies in Texas have received that Gold Seal of Approval. Then you know that you're dealing with something special. And then something that nobody else does, as far as I know, my number, 281-703-8050, every single one of the families that we help have my cell number. So imagine you being taking care of somebody, or somebody's taking care of one of your loved ones, and you have the number directly to the owner. You're not gonna go through a receptionist or a secretary, or he's gonna call you back. No, you're gonna call me on the cell phone number. The only one I got were my wife, my daughter, my grandkids called me on, and eventually my great-grandkids will call me on one day, and I don't know of any other agency that does that. And the reason I do that is because we're very proud of what our nurses, and I'm not afraid to answer the phone anytime. Because I know, once in a while they complain about something, usually a minor detail, but overall, we are a very, very excellent agency.
Right. And I think that's definitely something we'll touch on a little bit more about what makes us different for our next meeting next week. But today I think we were able to really cover all the services, and everyone can learn a little bit more on our Instagram, LinkedIn, Facebook, and YouTube channels, and they can always call you with any questions.
That is right, and it will help us if you follow us, or at least subscribe, and we'll keep you abreast of what's going on in the industry. And that day, whenever your family needs our services or you need our services, you're gonna be ready. We're gonna have a relationship, somewhat of a relationship. And when you call us, you know that you're not calling a strange, like a new agency that you don't know anything about. So keep that in mind, and please join us. Like Maya said, we follow us on YouTube, LinkedIn,
Instagram,
and Facebook. I'm kind of old-fashioned, so I'm not up to par with all those things yet, but I'm getting there. So until next time, thank you, Maya. Thank you for helping me out, because when I do this by myself, it's not as easy. But thank you, and we'll be back. Please look us up. We're gonna do one of these every week to keep you informed. And we really thank you for joining us today, and we look forward to talking to you next time.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio.